Basically, what's happening is people have stopped going to their GPs for their regular checkups, and also breast screen, bowel screen, and cervical screen have seen a reduction in patients attending. And also people are not following up results that they have from their pathology. So what this means is the cancer diagnosis is delayed for many Australians, which could have really bad consequences for them.
Have we statistically seen a drop in cancer diagnoses?
Yes, we have. So Cancer Council Victoria have actually reported a 37% drop in breast cancer diagnosis already since the COVID crisis.
So, I mean, all of the technology, all of the advances we've had in medicine over the past few decades, so much of that has really been based on prevention and catching cancers early. And we've had quite a bit of success with that. How detrimental is that now we're, I guess, reverting back to perhaps catching these cancers at a much later date?
Well, what happens is the earlier you can catch cancer, the greater your chances of cure. So for breast cancer, it's 87%, bowel cancer 59%, cervical 87%. So if we catch it later, then people are less likely to get cure and are more likely to die. So it's very serious, and people need to go to their doctors and have all their tests followed up. If they have any symptoms, they really need to check it, because it's life-saving if they do.
It's such a double-edged sword, because people are obviously avoiding going to the doctor or going to the hospital because they don't want to expose themselves potentially to the coronavirus, and yet by avoiding doing that, they actually are still putting their lives at risk.
That's right. I think we need everyone to know that healthcare professionals are doing everything they can to protect you. So it's important to follow up any symptom that could be cancer, because it is life-threatening, and 50,000 Australians normally die every year from cancer, which you can see is a lot more than so far with COVID. Yeah.
I guess, Doctor, one of the other things that is really sad at the moment for people, having a loved one that is diagnosed with cancer is always incredibly hard. How has that anxiety been exacerbated by COVID? I mean, even just not having the visitors you usually would, because people, I know I wouldn't feel comfortable going and visiting someone with cancer just in case I was asymptomatic with COVID and I could potentially putting them who was already, immunocompromised at a higher risk.
Yeah, look, anxiety and fear at the moment is really high, and it's exacerbated by COVID. I just encourage people to keep talking to their loved ones if they do have a cancer diagnosis, on the phone or on video, and just reassure loved ones. I mean, that's what I do at the moment. My mother's got a breast cancer diagnosis, so I talk to her regularly on videos just so she knows that I'm there to keep her calm and to help me too.
Do you feel that it's more isolating to be going through a cancer battle at the moment?
Yes, it is. It's scary for everyone, and it's scary for the family and, trusted confidence of people with cancer. So I think it's a really hard time for everyone.
So are the key messages, I guess, that if you do notice something that is off, you should go to your health practitioner regardless of the risk of COVID, and obviously take any precautionary measure you can, and also just to keep in touch with those people that might be experiencing or going through their own cancer battle at the moment?
Absolutely. It's really, really important to talk. And now we've got your own GP can do telehealth consults, and that's reimbursed. So keep on the phone to your GP if anything's not quite right. Get it checked out, get your tests done, take precautions to protect yourself from COVID. But it's really important because it could save your life.
How effective are those meetings? Because it's not like you could get a mammogram over a telephone. So obviously, there's certain things that could be getting missed.
So it depends on the cancer. So melanoma, for example, video consults are very good in certain types of cancer. But for things like a mammogram, bowel screen, for example, you can send it in the mail. So every Australian over 50 gets the kit. So they could easily just post their package off. And mammogram, look, you have to go and get that done. But breast screen's open, and all of the pathology is open, and it, healthcare professionals take every step to keep you safe.
Well, Doctor, thanks so much for your time this afternoon. Lots of love to your mum as well. I hope that she is going okay, and I'm sure she enjoys those video chats with you.
Yes, thank you. She's going great. She's through all the treatments, and 80% chance of cure is what my mum's getting we think, because she's been through the breast screen and done all the treatments as suggested, even though her hospital had COVID in it.